Hi, my name is Dr. Christopher New. I'm a cosmetic dentist at Dental Boutique in Chatswood.
Okay, Doc, how long have you been a dentist?
So I've been a dentist for the last 6 years or so.
6 years,
Yeah.
okay. So tell me about the worst case scenario, the worst teeth thing that you had to fix.
That's a tricky question. Well, I guess the you know the most difficult things that you're going to be seeing in dental is always somebody who's maybe never had the opportunity to look after their teeth or been maybe educated in the way that would be best suited for them. It's not necessarily, I think the worst is not necessarily how the teeth are looking, but kind of how it has affected their life. Like you definitely see a lot of people in here who for a long time have been like very ashamed of how their teeth have looked, and you kind of get to the point where even if it doesn't matter how the teeth are looking, but if it's affecting you so much that you feel ashamed that you can't be seen in public or smile comfortably, that's always going to be like, it's a bit of a tragic story. And especially when there are solutions out there. And actually one of the best things about working here is really when you see somebody come in for the first time and you won't even smile, like you're just upset, it's like emotional. Hopefully by the end of the appointment, we really see people who smiling big, and like you can see their whole personality change, and it could be it's a really rewarding thing to see. Yeah, it's just probably the best thing about being able to work here.
Okay, Doc. So a lot of people, Australians especially, they put off going to the dentist because of cost. And a lot of them, since we are a country, a multicultural country with a lot of people living, born overseas, they tend to go back to their home countries to do their dental treatment. And sometimes they come back with very bad treatments. So the main reason why they do this, go overseas, is because it's expensive here. So tell me about what about Dental Boutique, the kind of cost that's something for like a root canal, and how Australians can be able to afford it.
For sure. No, actually I think that's a really important question. And there's two parts to it, especially coming from like an Australian perspective. So number one is, it's important, I think, for us to make sure that everyone feels comfortable to discuss it. Like transparency, people can sometimes feel uncomfortable about discussing money. It's regardless of the treatment, it's important. We want to be upfront. We kind of pride ourselves on the fact that no matter your budget, we can find something that will make you have a happy smile, basically, as well. Having that open discussion is really important. Now, the other aspect of that is actually our payment plan system. So probably one of the best things about Dental Boutique is literally that we know, like we're very aware that dental treatment can be expensive. How can we make sure that it's available to everyone to the best of our ability is by offering things like payment plans. I know that us as Dental Boutique, we have several different options where we can find an avenue for you to maybe access the funds to get the treatment that they need or you need at an appropriate time. Whether that's doing something like through super or through certain payment plan options that we've got, like HUM or TLC. Again, we need to find a solution for you.
Okay, and finally, 5 top tips that you can give as a dentist for anyone who on oral dental care that they can do at home for free of charge.
Really nice, easy. Yeah, okay, that's a really good question. Well, I guess one of the most important ones is what sort of toothbrush you're using. So of course, I normally tell people, look, you can do a good job with a manual toothbrush, but it's a lot harder to do a bad job with an electric toothbrush than a manual one. So soft electric toothbrush is something that you can use all the time. It's a really effective way to clean the teeth. Number 2 is actually flossing as well. So floss, I kind of tell people that if you're brushing without flossing your teeth, it's kind of the equivalent of like vacuuming your house without ever moving any of the furniture. Like you can maybe get away with it a little bit, but flossing is really going to be the difference between actually making sure that there's not a lot of build-up and minimizing how much damage there is to the teeth in between your cleans. Other good tips, chewing sugar-free gum is always a good one. Mouthwashes used appropriately can also be very helpful to like look after yourself. And also other good ones is actually, people always say that having more like crunchy foods are a lot better than having like soft syrupy types of foods there as well. Finally, when you're sort of talking about like eating and drinking, honestly, even just rinsing your mouth out with water, or even better, like brushing, cleaning after eating, those are really going to stop the risk of like heavy plaque buildup causing damage to the teeth and gums.
This means after lunch as well?
If you can. Like, I've got plenty of patients who are very meticulous with it, and they always have really great oral hygiene. It's not always possible for everybody, but at least twice a day, morning and nighttime, it's going to be really important. And floss.
Okay, doctor, what about some Australians really love their fizzy drinks?
Yeah.
Can that cause like plaque in a long run?
It can. So when you're talking about fizzy drinks in particular, it's not so much the plaque that we're worried about, but it's also going to be the sugar content and also the acidity there as well. Really with like a fizzy drink, they're acidic, they can start to damage the teeth, they can erode them. And also when you combine that with a lot of them that have a lot of sugar, a lot of acid, a lot of sugar together, that's a very quick recipe for ending up needing a couple of fillings or something like that. Ways to avoid it, of course, maybe try to drink a little bit of water or rinse your mouth out again. Don't actually brush your teeth right after having a fizzy drink either. That's a very common thing. Wait about 20 minutes to make sure that acid's not going to damage your teeth.
Okay, finally, doctor, one last question for kids who hate to brush their teeth at night, especially. They do it in the morning, but not at night, and they tend to get tired and go to sleep. What is one tip to get them to brush their teeth before they go to bed?
That's tricky. Well, I guess it's important to understand that actually there's a lot of research to show that out of the two, it's the nighttime brush that's actually going to be like really, really important in terms of preventing decay. Things that you can do as a parent, perhaps try to make it fun, try to make it like a family activity. Like, kids are, I guess, like sponges in some ways, like they are reflections of ourselves. So if we can, set a good example for them, make it a family activity, set a timer as well, all of these things. Maybe even, I know sometimes children, I have had patients who've had like a little sticker board or like a reward type of thing where when they're looking after their teeth well, they can be rewarded. And once you have about 2 weeks of that, habits form and children learn a lot. So it can be helpful.
Awesome. Thank you, Doc.
Yeah, no problem. Thank you so much.